Good afternoon. My name is Sue Chrysler, and I'm the Associate Director for Safety here at Texas A&M Transportation Institute. And we're hosting the first of a series of webinars this spring term. So I'm happy to introduce my colleague, Melissa Tooley, who's the Director of External Initiatives, who's here, who's going to report on a project that she did with our colleague, Johanna Zmud. I think you all came into the webinar muted through the software. If you have a question, you can use the chat box and I'll be monitoring that throughout the presentation. So I'll turn it over to Melissa.
Okay, thank you, Sue. Well, as Sue said, the project that Johanna and I worked on is titled Older Drivers and Transportation Network Companies Investigating Opportunities for Increased Safety and Improved Mobility. And this project came about because Johanna and I have aging parents, and actually in talking to Sue, who has been dealing with some of those same issues, we were concerned about their lack of mobility for being able to go to social engagements, getting to needed health care. I mean, it's hard to watch people that are close to you who have limited ability to go and do the things that make them happy and the things that are necessary for their health. So we started talking about transportation network companies, or TNCs, and how maybe they could be, more of an option for older people, as America ages, to help people to get where they're going. And of course, the safety benefits, because this is a safety center. We looked at it from the perspective of a reduced risk of crashes. Older adults have higher crash and fatality rates. 17% of traffic fatalities are people 65 and older. 20% of pedestrian fatalities are older adults 65 and older, and they're only about 13% of the population. So, anything that we can do to reduce that will have a positive safety impact. Also, there has been some research that indicates that TNC drivers operate vehicles more safely than average drivers. That study found that when you look at things like speeding, aggressive driving, phone use, hard braking, that TNC drivers operate vehicles better than your average driver. And the researchers theorize that that is because TNC passengers have an opportunity to rate their drivers. So drivers have a pretty strong incentive to get a good rating from passengers. So maybe that has something to do with it. Either way, you combine that reduced risk of crashes from older drivers with safer drivers and TNCs, and you have the potential to improve safety for the traveling public in general and also for older passengers. Now, the purpose of the study was to determine what the factors influencing the adoption and use of TNCs by older populations might be. And we wanted to see what would be the most effective ways to mitigate those negative perceptions. In other words, why aren't older Americans using TNCs more, and what can we do to perhaps encourage them to use that option? The methods we used for the study were pretty straightforward. We did a literature review to see what research had been done in this area. At that time, there was very little work that had been done. We used that information to inform the questions that we did for the expert interviews and for the focus groups. The expert interviews, we talked to TNC providers. We also talked to human service organizations to find out what their experiences have been in working with older people and what some of the challenges are. And then we also did focus groups with older people in both Richmond, Virginia and Houston, Texas. And why Richmond and Houston? We wanted to get a perspective from maybe a smaller urban area and a major urban area. But also, Houston has a really wide range of transportation services, including social agencies, transit, paratransit, taxis, well-established TNCs. Whereas at that time, Richmond had really limited transportation options besides personal vehicles. And while TNCs were available there, they weren't as firmly entrenched as they were in Houston. So we felt like we get a diversity of viewpoint by doing the focus groups in Richmond and Houston. So the literature review, we wanted to see what we could find regarding TNCs by older adults. And as I said earlier, there really wasn't a whole lot out there at that time. So there's limited data on demographics and travel behavior of TNC users, but we did find a research report done by the Pew Center in 2015 that said that 15% of US adults had used a TNC, but only 4% of adults 65 years and up had used a TNC at that time, and that adults 65 and over were among the least likely demographic groups to use TNCs. So when we talked to the various TNC services to find out what their programs were that could be useful for older people, we found a number of programs that are geared toward and could be helpful to older people. Uber has several different programs available on a limited basis. I mean, they're not necessarily available nationwide everywhere Uber is available. For example, Uber Assist. Their service model provides additional assistance for seniors and riders with disabilities. Drivers are trained to assist riders into the vehicle. The Uber Assist vehicles can accommodate folding wheelchairs, walkers, and scooters. And as of May of 2016, Uber Assist was available in 13 US cities. Uber Access provides wheelchair accessible vehicles, or WAVs, but doesn't necessarily have trained drivers to help with those. Again, it's a difference in service levels between these different programs. Uber Wave drivers are knowledgeable of accessibility needs and have received some training in that area, and the vehicles do have a ramp or a hydraulic lift should the rider need that. Lyft Concierge allows third parties to request rides for older adults through a web program, which eliminates the need for the individual rider to be able to have to use an app to access the ride. In other words, like a third party at, say, a senior service center or a nonprofit group or home care providers can actually access the Lyft app and order rides for people to get them where they need to be. Some of the other programs that we found during the LIT review were GoGo Grandparent, which is a telephone-based dispatcher program for Uber and Lyft. The rider doesn't have to go through an app. They can actually call GoGo Grandparent on their telephone and they will actually access the apps for them. So it gives them TNC access without having to use a smartphone. The users order rides through GoGo operators, and those operators monitor the rides throughout the rides, which alleviates some of their concerns about safety. Great Call Rides works with Lyft via Jitterbug phones and uses the Lyft concierge platform that we talked about on the previous slide to help them access rides. The service and ride fees are added to their monthly phone bill, and that particular service was in pilot phase at the time that we conducted the study. Ride with 24 was developed in partnership with Uber and 24-hour home care. It trains Uber and taxi drivers to accommodate older passengers, and it's accessed via a toll-free number. Again, they don't have to know how to use a smartphone to access Ride with 24. All right, so the expert interviews. The purpose of the expert interviews were to gather views of transportation needs and services for older adults, and to talk about some of the unique challenges that they face in using TNCs and just transportation in general. The interviews were semi-structured. They took about 60 minutes to complete, and we did 11 of them over the course of the project. We did interviews for TNC services and for human service organizations, or HSOs. We interviewed 5 TNCs, Uber, Lyft, Ride Austin, Silver Ride, and GoGo Grandparent, and then another 6 HSOs around Texas and some that operate nationwide as well. Some of the questions we asked the TNCs were, what kind of services do they offer older adults? Are they an app model only, or do they have other ways of accessing that service? What obstacles had their TNC encountered to providing TNC service to older people? Some of the questions we had for HSOs were, does that organization provide transportation for older adults? What are some of the obstacles they've encountered in servicing older riders who require transportation services? So when talking to the TNCs as part of the interview process, all 5 of the TNCs that we talked to do provide service to older adults in some form or fashion. But 3 of the 5 didn't specifically track rider demographics. There were only a couple that really tracked the ages of their riders. One of the TNCs that did said that 12% of 30,000 respondents to a survey they conducted were over 50. They didn't break it down any further than that. 30% of those senior riders reported owning a personal vehicle, and 18% reported living with a disability. One of the senior focused TNCs that we talked to, the majority of their riders were over 75 years old, and 30% of them were between 60 and 75. All of the TNCs, again, had services or accommodations that targeted older people. Some of them, they didn't all necessarily have all of these, but some of the things and accommodations that they have are alternative scheduling, like what I talked about earlier with being able to use a concierge service so that you don't have to access the ride through a smartphone application. Accessible vehicles that have special equipment for wheelchairs and other disabilities. Some of them provide door-to-door services, meaning that they aren't just dropped off curb to curb, but they actually take the rider up to the door and make sure that they get in. And then specially trained drivers that are aware of the needs of older people and are trained to accommodate those needs. Some of the challenges that they identified in the interviews were awareness that older people didn't know that they had these accommodations and services available, and they felt like that we needed to come up with some way to make them more aware of how TNCs can be helpful for them. Limited resources, that it's hard to find enough accessible vehicles to provide really good service, and that it's the number of trained drivers or people that are willing to be trained is limited. All right, for the HSO findings in our discussions with them, they all said that in recent years there's been an increased demand for trips in general from human service organizations, but there's also simultaneously stagnant or decreased service capacity, meaning that we need more and more trips and we have less and less ability to provide them. And we expect that to continue as America ages. The common trip types that people needed were obviously medical, but also just general errands, grocery store, et cetera, and also social or entertainment trips, which are very, very important for quality of life. The HSOs that we talked to had concerns regarding the ability of TNC drivers to provide necessary services. They also were concerned about having enough wheelchair accessible vehicles for TNCs, and this is just in their interactions with their clients and things that they had heard about TNC use in that population. They are concerned about the ability of some older people to utilize a smartphone to call that TNC and to adequately use the applications you need to be able to call and use those services, and also the low ability of TNCs in rural areas, which is where a lot of their constituents are. All right, the focus groups. That was where we went to Richmond and Houston and talked to older people about how they felt about TNC use. The purpose of those discussions were identify opportunities and also barriers to use. Why aren't they using them more often? To discern what their mobility options are. In other words, how are they getting around now? And also to determine what their preferred information sources are. If we were to develop information helpful for them, what's the best way to get it out to them? The focus groups took place in May of 2018. Again, there were 3 in Richmond and 3 in Houston. We broke them out by age group. The first age group was 65 to 74, 75 to 84, and then a third group at 85 plus. What we found pretty much uniformly across all groups is that there was a pretty high awareness of TNCs, particularly Uber. We were surprised at how many of them had heard of TNCs and how they work. Again, Uber was primarily the service that they were most familiar with. They had fairly little personal experience, although some of them had used TNCs in the past. The majority of the people in our focus groups hadn't personally used one. And there were some negative perceptions, primarily because of things they had seen in the press about, negative incidents that had happened with TNC drivers. They were all very aware of the media coverage of bad things that have happened with TNCs. But when we talked about what the benefits of a TNC might be, these are the things that they brought up. They don't have to worry about parking. So wherever they're going, they're going to be dropped off at the front door of their restaurant or their medical clinic or whatever without the need to have to walk across a parking lot or perhaps a block away if they had to park on the street. They felt like it was less stressful than driving themselves because there's no need to navigate, which can be difficult to do while you're driving, even if you're able-bodied, but would undoubtedly be a little more challenging if you had some form of disability. TNCs are very flexible in that they don't have to work around the schedule of a friend or a family member who might be providing them a ride. In other words, they can call a TNC anytime, so they have more flexibility. They like the idea of having freedom and independence from having to ask favors to get where they needed to go. They felt like TNCs were pretty cost efficient compared to the cost of taxis, and because in general they're significantly cheaper. And then of course faster than a taxi or a bus, in that taxis a lot of times you have to give them more notice than a TNC, and with a bus you have to deal with routing and maybe waiting at stops and things of that nature. So when we talk to the focus groups about barriers to use, the primary barrier that we heard was the need for a smartphone. While a lot of the participants in our focus groups had smartphones, there was a pretty significant number that didn't. And there was, even the ones that did weren't 100% sure exactly how to use the applications. Navigating the applications was a concern for many of our participants. They were concerned about the cleanliness and comfort of the vehicle. There seemed to be a perception among our focus group participants that TNC vehicles may not be as clean as a taxi. That was their perception. They felt like they needed more driver assistance than a typical Uber or Lyft or TNC driver could provide. And they were worried about the payment method. We heard a lot about a reluctance on the part of our older folks that were participating in the focus groups to having their credit card information available online. The idea of putting their credit card information into a TNC application was very worrisome to them. Other barriers to use, again, the concerns about TNC drivers based on what they had heard in the media about some adverse incidents that have happened. They were concerned about how those drivers are selected, how they're vetted. They're concerned about safety and trustworthiness. They're concerned about safety of the vehicle and whether the TNC drivers are insured and what would happen if there was an accident. If they were in the car, how would insurance handle any issues that might arise? They also felt like they needed door-through-door services. For example, if they're coming home from the grocery store, maybe assistance in getting their grocery inside. We talked about how they would feel about an extra fee if drivers were trained to provide door-through-door services. We got mixed responses on whether they would be willing to pay more for that. But they did suggest that there should be a certification for door-through-door drivers or for drivers that would provide that particular service. So next we talked about preferred training content and what kind of information would be most valuable to them. First was step-by-step instructions. The graphic that you can see over on the right-hand side of your screen is a graphic that is from a brochure that we developed as part of this project. It provides step-by-step instructions that are generic enough to pretty much fit with any TNC because they're all pretty much set up the same in how you access the services and the steps that you go through. So that was something that we developed based on their feedback. That training content should also have available tools and services. For example, if you aren't comfortable using a smartphone, how do you access Lyft Concierge? Whether you could talk to a, quote, real human, unquote, or not. There was a great preference to do that rather than book a ride through an app. Other information they wanted more, content for in terms of training would be, how do they determine what the cost is? How can you tell what the cost is going to be before you order the ride? Who is the driver? How are drivers trained? Is it safe? That they wanted training to include information on all of those things so that they would feel more comfortable using TNCs. They preferred in-person delivery, seminars or presentations and tutorials. They also like the idea of written materials rather than having to go online and access some type of tutorial. Brochures, pamphlets, booklets, something that they can pick up and read. What you see on the right-hand side of your screen is the cover of the brochure that we developed as part of this project. And as you can see, it's titled Using a Transportation Network Company. When we talked about where the training might be most useful for them, where it would be most easily accessible, some of their suggestions were to use existing meetings and gatherings at churches, community centers, and doctors' offices. Other interesting observations, almost all of our participants, even the ones 90 plus, almost all of them were still driving. Very few thought about mobility options after driving cessation. That particular observation really struck us because as we asked that question, when did you start thinking about what you would do when you could no longer drive? Literally no one was prepared to answer that question. And we began to realize very quickly that while many of us plan for retirement in terms of, financial issues, inheritance, that sort of thing, very, very few people think about what's going to happen to them when they can no longer drive. And I think, one of the big observations that came out of this is, hey, this is something that we need to all be considering more. It really struck us that came up over and over and over in discussion. I also became personally aware that I hadn't thought about it either, as were all of my fellow researchers on this project. The participants were aware of TNCs, but again, they had little or no experience with them. And they all felt that there was potential for TNCs to really help provide their transportation services. They were intrigued after we talked about it in the focus groups. Our recommendations were outreach. Get this information out there. We felt like after talking to the people in the focus groups and after conducting the research that TNCs do have tremendous potential to offer transportation options for older people and can make our roads safer as a result. That it would be useful to promote TNCs as a mobility option for them and provide targeted training on TNC use, and to raise awareness of specialized services for older adults, both in terms of dispatch services, how you call TNCs, and also that there are accessible vehicles available through some of these programs that TNCs offer. The training materials that we developed as a result of this activity, we have a seminar style presentation with speaker notes. That's the basis of what I'm presenting this afternoon. But we also provide developed materials for training for older people, the outreach presentation that I talked about earlier, and also the brochure. And some of these graphics are from the brochure, this How Does a TNC Work? You can see that it gives 6 basic steps: downloading, requesting the trip, what you can do during the trip in terms of being able to share your location with a friend. They responded very positively to the idea that someone knew where they were, and tracking where you are on the phone app's map, how to set up an account, pick up, what happens at your destination, that you don't have to pay, that there's no exchange of cash, that everything is done through the app itself. This is the actual brochure, and again, there's the cover again, Using a Transportation Network Company, but you can see that it's organized as what is a TNC, those 6 steps that I talked about on the previous slide. How is a TNC different from a taxi? How does a TNC work? Again, all this information is provided because we were told in the focus groups and in the literature review and the other materials that we developed that, hey, this is what's really important to older folks who may be using these services. What are some of the benefits of using a TNC? We addressed safety and security concerns, talked about service options, and then a series of what if questions. What if you have to cancel a ride? What if you can't find the driver? What if you have a complaint about the driver or the service, or a question or problem with the fare, or if you left something in the driver's car? These are all questions that came up in the focus group, so we felt like that they needed to be addressed in the materials that we developed for distribution. And then the back of the brochure just has, for more details, who to contact. And of course, the information about safety, who sponsored this project, and Texas A&M Transportation Institute, which is where the researchers are that did the research on this project. And I'd be remiss if I didn't talk a little bit more about the project team. Johanna and I were co-PIs on this project, as I said in the introductory slide. Laura Higgins worked with our students and helped with the focus groups and the literature review. Ben Edelman and Merritt Moran are researchers at TTI that helped with the focus groups and the literature review and some of the other activities that we did. And then we also had a graduate student who worked on the project and a summer intern who helped us with some of the outreach materials. So the project is indebted to all of these researchers for their contributions. And then I'm not sure how many people we have online, if anybody has any questions. Oh, we do have questions on the line, and Sue's gonna read them to me.
No,
but
there's people on.
Oh, there are people on. Okay, good. But if anybody has any questions, you can type them in on the chat line.
I have posted a link to the report in the chat box.
Oh, great. Okay. A link to the report is available in the chat box. And in the future, if anyone's viewing this, this is my contact information, and you can contact me at that phone number or that email anytime, and I'd be happy to answer any questions you might have. All right, thank you.
I have a question.
Sure.
When you talked with people about the concierge type services like GoGo Grandparent, were they aware of the added cost of those?
Well, no, I mean, they really weren't aware of any of it. They didn't know that GoGo Grandparent even existed. We did tell them, though, based on our literature review, that there was a small, or rather really a pretty nominal fee that was involved with the use of GoGo Grandparent and like Lyft Concierge. But it wasn't, we didn't know exactly how much it was. They weren't aware of it, to answer your specific question.
Okay.
But they were aware that it might cost a little more to do it that way.
We have a question from someone online. Can you tell us more about the preferred training content, specifically available tools and services?
I'm assuming you're talking about the training information that's available through this project, because we didn't find anything that was available when we started the research. What we developed for this project consisted of, there is a presentation that is suitable for use at, say, if you went to a senior center and you were speaking to a group of people. Yeah, yes, and that information is all posted on the safety website, actually, because it's a deliverable for this project.
It's the same link I provided.
Yeah, at the same link that is provided in the chat room. We also have the brochure that I talked about in the presentation earlier. And then there's also a more technical presentation that talks a little bit more about, you know, with all the more detailed information about the, you know, the interviews and the type of information that we collected and that sort of thing.
Okay. We have another question. Did TNCs not seem cost prohibitive for your focus group participants?
Well, they all seem to understand that TNCs were less expensive than taxis. What struck me was their perceptions of the training level and selectiveness for the actual drivers of taxi type vehicles versus TNC type vehicles. But they did seem to generally acknowledge that TNCs were a less expensive option.
Okay.
Okay, thank you.
All right, thanks for tuning in. The full list of the webinar series is available on the safety website at VTTI, and there's a tab that says webinar series. The next one is Wednesday, February 5th at 4 Eastern, and that is a project on big data analytic techniques for crash safety data.